Level 1. The first cut. You are 22 years old. You're holding a scalpel for the first time. Not in an operating room, in a lab, on a cadaver that smells like formaldehyde and something you don't have a name for yet. Your hands don't shake. That surprises you. The professor is watching. 18 other students are watching. You make the incision clean, straight, confident. He nods once. That nod becomes everything. You go home that night and eat instant noodles in a studio apartment that costs $900 a month. You have $340 in your account. You have $210,000 in student loan debt. You don't sleep well, but when you close your eyes, you see the incision. Perfect. You think, I was built for this. Level 2, Medical School Year 3. The classroom is behind you now. You're on the hospital floor. Scrubs, badge, clogs that squeak on linoleum at 5 a.m. Your attending is Dr. Mara. She hasn't smiled at you once in 6 weeks. You've decided that's the goal. Make her smile. You're assigned to a bowel resection. You don't hold the scalpel. You hold the retractor for 4 hours. Your arm burns. You don't move it. After the case, Dr. Mara looks at you and says, "Good hands." That's it. 2 words. You replay them in the car, in the shower, at 2 a.m. when your pager goes off, and you sprint back to the hospital. You miss your best friend's wedding. You tell yourself it's worth it. You're not sure yet. Level 3, Intern Year. This is where people break. July 1st, you are officially a doctor. No one feels more terrified about that than you. You're the bottom of the surgical food chain. You put in orders. You draw blood. You redo the wound dressing on the guy in room 7 because the night nurse said it looked off. It looked very off. You're glad she called. You make a mistake on a medication dosage. You catch it yourself. You report it yourself. Your chief looks at you like you've confessed to a crime. You haven't, but it feels that way for 3 weeks. You eat vending machine sandwiches at midnight in a break room that smells like burnt coffee and stress. Your salary is $58,000. You work 80 hours a week. Do the math. You don't. You call your mother one Sunday and she asks if you're eating. You say yes. You haven't had a real meal since Tuesday. You keep going because there was a patient last week, ruptured appendix, 19 years old. You ran the case with your attending. She walked out of the hospital 4 days later. She waved at you in the hallway. That wave pays your debt for a moment. Just a moment. Level 4, Residency Year 3. You are starting to look like a surgeon. You operate twice a week, sometimes more. Your hands are precise now, economical, no wasted movement. Your attending trusts you with the open portion of a cholecystectomy, then the closure, then more. You develop a reputation. The scrub nurses know your name. That matters more than you expected. You pick a subspecialty, cardiothoracic, the hardest path. Everyone tells you this. You already know. You start staying late, not because you have to, because the OR at 11 p.m. is quiet, and you can practice suturing technique on a piece of foam without anyone watching you chase perfection. You are beginning to understand that perfection isn't a destination, it's a discipline. Your relationship ends. She says she feels like she's dating a ghost. You want to argue. You can't. She's not wrong. You are becoming something. You're not sure what yet, but you can feel it forming.
Level 5, Chief Resident. Your name is on the board now, not next to someone else's. Your name. Attending of record on 3 cases this week. You are responsible, fully. If something goes wrong, it's yours. You understand now why senior surgeons carry that look in their eyes. Not arrogance, weight. They carry weight. You have a complication, Post-op bleed on a bypass patient. 3 a.m. You're back in the OR before you're fully awake. You find it. You fix it. Patient stabilizes. You sit in the scrub sink afterward and your hands shake for the first time. Not from fear, from release. You talk to no one about this. There is no one to talk to who would understand. The hospital is your world now, your language, your culture. Outside these walls, you feel like a tourist. Your student loans have been in deferment for 6 years. $280,000 now, with interest. You don't look at the number. Level 6, first year attending. $380,000 a year. The number hits different when it deposits into an account that used to hold $340,000. You are staff now, an attending physician, cardiothoracic surgeon at a level 1 trauma center in a city that doesn't sleep. You have your own patients, your own cases, your own complications to carry home. You buy a car that isn't falling apart. You feel guilty about this. You don't know why. Residents look at you the way you looked at Dr. Mehra, with fear, with need, with hunger. You try to remember what it felt like to be them. You're strict but fair. That's what they say in the feedback forms. You take on more. Trauma calls, elective cases, a complex redo sternotomy on a 67-year-old man who has already survived 1 bypass and is terrified to go under again. He grabs your hand before induction and says, "I trust you." You feel the weight of that sentence for 6 hours inside his chest. He goes home 10 days later. You don't celebrate. You move to the next patient, and the next, and the next. This is the job. Level 7, mid-career, the machine. 5 years in, you are good. You know it. The data confirms it. Your outcomes are in the top quartile. Your complication rate is low. Your patients survive at rates that get you invited to conferences. You speak at one in Boston, in Chicago, in Zurich. You are building a reputation that extends beyond your hospital. But something is happening. You operate 6 days a week sometimes, not because you're forced to, because you don't know how to stop. Your circadian rhythm is a concept other people have. You miss your nephew's birthday, then his next one. You send a gift, an expensive one. It doesn't cover the distance. You are developing what surgeons call a God complex. You know this is a dangerous phrase. You've seen it destroy people. You tell yourself you're different. That's what they all told themselves. A colleague at your hospital, one of the best trauma surgeons you've ever known, burns out at 44. He leaves medicine completely, goes to Wyoming, buys land. You think he's running away. Later, you wonder if he was the smart one. Level 8, the case that doesn't leave you. You will remember the exact date. October, a Tuesday. The OR is cold the way it always is. The patient is 41, a father. Emergency repair of a type A aortic dissection, the kind that kills people before they reach the hospital. He made it, barely. You operate for 9 hours, and you lose him on the table. You do everything right. The charts will confirm it. Your colleagues will confirm it. The M&M conference will close the case with no deviations from standard of care. It doesn't matter. You walk out of the OR and stand in the hallway and stare at the wall for a long time. Someone asks if you're okay. You say yes. You are not. You go home. The apartment is quiet. You sit in the kitchen. You don't turn on the lights. You go back the next morning because that's what surgeons do. But something has shifted. Level 9, the question you can't answer. You are 42 years old. You have saved hundreds of lives. You know this. The numbers are real. But you're counting the others now too. Surgeons aren't supposed to do that. You were trained not to. Outcomes are statistical, they said. You cannot carry every case. You carry them anyway. You start talking to a therapist, not because you want to, because your department chief gently, firmly tells you that she thinks you should, the way Dr. Mehra used to give feedback, not a suggestion, a direction. You sit in a beige office on a Thursday afternoon, and a woman asks you, "What do you feel when you lose a patient?" You don't answer for a long time. Then you say, "Responsible." She writes something down. You realize you've never said that word out loud before. Level 10, the crossroads. You are offered a division chief position, less operating, more administration, more politics, more meetings about budgets and staffing ratios and patient satisfaction scores. Your hands go cold at the thought. A junior colleague asks for your advice. She's brilliant, sharp, the best resident you've trained in a decade. She wants to know if it's worth it, the sacrifice, the years, the cost. You look at her for a long moment. You think about the 19-year-old with the ruptured appendix who waved at you in the hallway. You think about the man in the kitchen with the lights off. You think about Wyoming. You say, "It's the hardest thing you'll ever do. And there are days you'll hate it, and days you'll feel more alive than any human being should be allowed to feel." She nods. She already knows what she's going to choose. So do you. Level 11, the answer. You turn down the chief position. You go back to the OR. You operate on a Wednesday morning, a redo mitral valve, 4 hours, difficult anatomy, 2 residents watching your every move. You talk them through it as you work. Feel for the plane here. Gentle, don't rush the tissue. One of them will remember that line for the rest of their career. They will say it to their own residents one day in an OR you'll never see, in a city you've never been to. You don't know this yet, but this is how it spreads. The patient wakes up in the ICU 6 hours later. His wife is in the waiting room. She's been there since 6 a.m. When you walk out in your scrubs, she stands up. You say, "He did well. He's strong." She covers her mouth. She says thank you in a way that contains an entire lifetime. You drive home. You eat a real meal. You sleep 8 hours. Tomorrow, you'll be back at 5:30 a.m. The board will have your name on 3 cases, and somewhere in the hospital, in a lab probably this time of year, a 22-year-old is holding a scalpel for the first time. Their hands aren't shaking. The cycle begins again.